When we are able to help to calm that stress response, really everything else in our body, all of our pains, all of our aches, all of our bloating, all of our everything begins to follow suit. For me, having had several brushes with different components of sort of a chronic fatigue picture, for me, my single most important thing that I attend to on a daily basis is my cortisol response.
For so many people facing chronic conditions, the scariest part isn't just the exhaustion or the symptoms themselves, it's also the confusion. You know something's wrong, but your lab tests all come back normal. And well meaning doctors all too often seem to offer little more than prescriptions or dismissals. And you're left wondering if you're ever going to get any answers about what's going on. But today's conversation right now brings us the rare perspective of a medical doctor who looks beyond prescriptions and surface symptoms, digging deeper into the roots of fatigue and recovery and the way most of us never hear inside a doctor's office. If you're new here, I'm Raelan Agle, and on this channel and podcast, we dig into the insights and experiences that reveal what truly helps people move past CFS and Long COVID and other chronic health struggles. And today I am thrilled to be joined by Dr. Scott Resnick over in beautiful Whistler, Canada, a board certified physician trained in surgery and OBGYN with a fellowship in functional and regenerative medicine. For more than a decade, he specialized in functional approaches to fatigue, pain, hormone imbalance, and just overall health optimization. And Dr. Resnick also brings a personal lens to all of this. He knows firsthand the roller coaster of fatigue and recovery. Dr. Resnick combines deep medical training with lived experience and just compassion for patients who feel understandably lost and often unheard. And his message is clear. Your symptoms are real, they are understandable, and with the right approach, things absolutely can change. So much great stuff we're going to get into in this discussion. So let's dive in. Dr. Resnick, incredible to have you here today. Thanks for being with us.
Oh, I'm so excited to be here. I've been looking forward to this for some time and sharing some of my experiences as a doctor, as actually a fatigue survivor myself, and help your viewers to get a little insight into this really important confluence between the way that our minds work and the way that our bodies work. And as you know, they can't be looked at separately.
Yes. I think you are found the exact topic that our audience wants to hear about. And I love that we're going to get into some of the more physical and things that are happening in our body because we talk a lot here about the mind-body connection and the nervous system, which is really important. But it's also important to look at everything else that's going on and how that all interacts, and how we can, come at things from different directions.
Well, I think that's a really
Yeah.
good observation because, as we both know, there are some biological factors associated with chronic fatigue. I mean, there are some people who are profoundly hypothyroid or have infections and things like that. But
Mhm.
there are also a number of different symptoms that occur in the body, and it's really easy to focus on those symptoms and to be aware of your belly pain or your bloating or your aches and pains. And it helps to recognize that, so much of the mind body connection starts in the mind, but ultimately our perception of some of these symptoms occurs in our bodies. And these are the aches and the pains and the bloatings and the constipations and things like this. So I think it's interesting to start to tease this apart and say, where is that confluence? How is that we can translate something that starts in our brains to something that we feel in our bodies that ultimately causes us pain or discomfort?
Yes. And I love that, or I think that one of the reasons people respond to you and your work so well is that, as you mentioned, you have both a professional and a personal relationship with things like chronic fatigue.
I do.
So tell us about that. What personally and professionally brought you to this place where you are right now doing this work?
Okay, I'll start with the personal part of the story. And that is that, I mean, I think anyone who's done medical training has been in a highly stressful environment. So I did 2 years of general surgical training. I did 4 years of training as an OBGYN. And what this was every second or third day, I was spending 36 hours straight in the hospital. So what it does is that instantly starts to wire your hypervigilance because you never know when the pager's going to go off, when the surgery you did earlier that day goes wrong. You need to run somewhere else. And what I found is I found that as I got into my professional career as an obstetrician gynecologist, and this was 25 years ago. Since then, I've really focused on functional medicine. I found it was kind of hard to turn that stuff off. And the reason I'm sharing this is because one of the, I guess, the monsters in my own personal closet is my relationship with cortisol. And what I found is I found that when I let myself think too much, when I let myself fret about too many things, that I actually get a cortisol level which is really, really high. And then, as we might discuss later in this podcast, the old song says, what goes up must come down. So we can maintain kind of like this high cortisol state for a period of time. And then after a while, it just kind of crashes. And I was at a point in my life where I was leaving a community I'd been in for a number of years, closing the medical practice, moving across the country, starting another medical practice, building a house, buying a house, and selling a house. And as you can probably guess, that all this added up to really pretty significant cortisol dysfunction. And I found myself just wiped out. I mean, I would like, there were times in the afternoon, and I'm sure that a lot of your viewers can relate to this, where I mean, there were times I had to pull my car over when I was driving because I was so tired and everything was kind of swimming around and it felt like I was driving on an angled road. And I would literally say, this is dangerous. I need to pull over. So what happened was, I think that starting back in my medical training, I learned how to ramp my cortisol and my adrenaline levels up sky high because I needed to. That was, to use your words, that was an adaptive response, right? And what I found is I found that when external circumstances or whether I allow it to happen, if I'm unable to keep that cortisol response tamped down, I start having symptoms. And I think what I'll do is I'll jump forward a little bit, which is to say that for me, managing my fatigue is an ongoing practice. So I don't think that anyone who's really ever developed some really significant amount of chronic fatigue or ME can ever say that they are 100% better. Would you agree with that? Would you say that you find that maintaining your health and wellness requires some daily attention to what might be triggers?
It does. I would say I am 100% past chronic symptoms and chronic illness, but I still have symptoms. I still have fatigue. I still
Hmm.
have to do all the things that I used to do. It just looks a little different so that I feel well. And I don't always feel well. So, yeah,
Right.
I never feel stuck in that chronic symptom state. But, oh, yeah, yeah, I don't
So I
always
think
feel
what you're
great.
saying and what I hear is that this is a dynamic process. And
Yeah.
our bodies are kind of built to adapt to changes in the environment in a dynamic fashion. So when things are going great, when your relationships are good, your job is going well, your bank account is flush, it's easy to kind of offload some of those stresses that it's so easy to get ourselves wrapped around in. And I would say similar to you that I do all the activities that I want to do. I've got the energy and focus to be able to do that over the course of the day. That said, I know that I'm never quite that far away from being able to backslide a little bit. And I just need to pay particular attention to my sleep and the foods that I eat and the way that I exercise and things like that. So I was telling you about my personal experiences. So it started really kind of like with a really significant cortisol dysfunction. And then what happened was about 8 years ago, I was living in Tennessee, minding my own business, driving to pick up my daughter at the airport, and a methamphetamine addled driver crossed 3 lanes of traffic and smashed into my car, giving me a
Oh,
really pretty significant concussion. So, that was another one of these occurrences that kind of gave me some changes in my cognition that I've struggled with. And most recently, I'm actually working to address what's called a Bartonella infection. And Bartonella is one of these infections that's kind of along the lines of like Lyme disease. So what it is it's a bacteria that's achieved through like a tick bite, or in this case, a flea bite, and can potentially affect different symptoms as well. So that's kind of like been my personal experience with chronic fatigue, and I think it really got put into place with my training years ago. And if I'm not careful about my sleep and my diet, my activity
mhm.
levels and things like that, I can find myself backsliding. But what about professionally? I would say that what I've noticed that fatigue is one of the most challenging things for doctors to work with. And by extension, for individuals to work with their doctors. I mean, there's not one laboratory test that defines fatigue. You can't draw a tube of blood and say, "Oh, your fatigue levels are high. Let's put you on this medication or this activity to get you feeling better." And I think what's challenging is that for a lot of doctors, they don't know where to start. And I can tell
Mhm.
you that in medical school, that there's not a lot of instruction as to how to address this concept of fatigue. And so what I found that in working with my patients that I needed to expand my thinking a little bit and start to think outside of the box. And one thing that really helped me was to learn to appreciate how the body works from a functional medicine standpoint. So would you say that if I use the term functional medicine, that your viewers understand what this is and maybe how this is differentiated from sort of the conventional way of medical thinking practice?
I would imagine a lot would, who's some of the most well-informed people on the planet, I always say. That said, we could all always appreciate and, do with a little bit of a reminder or hearing it explained.
Okay, that's
So
perfect. I'll make this quick. So, I was trained in an allopathic medical model, and I went to an allopathic medical school, did the allopathic residency training, and I've been practicing for about 10 years. And I said, I'm going to look up allopathy in the dictionary. And I did that. And I realized that the allopathic model is simply assigning a drug or medication to counteract a symptom. But what this does is it never extends the thinking to ask, what was it that caused or precipitated that symptom in the first place? So, in my opinion, all that allopathic medicine does is address symptoms and then use drugs to cover them up. Now, Raylan, I'm not a I'm a big fan of modern medicine. I mean, if I'm riding my mountain bike and I break my femur, it's like give me an antibiotic and a titanium rod and general anesthesia, whatever it requires to get me fixed. But for so many things that people struggle with in terms of their health, whether it's high blood pressure or cardiovascular disease, autoimmunity, the conventional medical model is just resigned to picking a drug, and then don't get started about all the pharmaceutical companies and how much money they're making and insurance policies and all this other stuff. So what functional medicine does is it takes a different perspective on health, and it says, wait a minute, can we roll back these diagnoses? Can we deconstruct the body into a set of systems or components that we can analyze and then fix them? Because when we've optimized our nutrition or the way that our biology works, our physiology, our biochemistry, it's remarkable how much ability the human body has to turn around disease. So it's a different way of thinking. And part of the problem is that so many conventional doctors are just indoctrinated into this very myopic, very one-sided way of looking at health, which is, where's the drug? Where's that drug for my fatigue patient? Oh, I need to put them on a stimulant. I
yeah,
need to put them on an antidepressant because they need a drug. But what you and
yeah,
I recognize is we recognize that the human mind is so powerful. And when we get into discussions about the limbic system and the hypothalamus and the pituitary and how these different systems are basically the headwaters of all of the way that our biology functions, it should really be no surprise that we are able to guide a lot of our health, really starting with our minds. So working with my patients, what I started learning was that, wow, there are a lot of ways that we can ask questions about their health that gives different insight. We can make different measurements. I mean, if you go to your doctor and your doctor says, I'm going to do some laboratory work, I can bet 9.5 times out of 10, they're going to get a blood count and they're going to get a chemistry and they're going to get this old fashioned, cholesterol panel. And if your cholesterol is high, you're going to get put on a cholesterol lowering drug. And to see abnormalities in the blood counts or the chemistries, you need to be bleeding. You need to be in kidney failure. I mean, there really needs to be something pretty significantly wrong. So the
yeah.
problem is that one, conventional medicine doesn't have the language to understand what somebody who is struggling with fatigue is dealing with. Two, we really don't understand how there are different tools at our disposal to get deeper insight into the way that our biochemistry needs to work, because when our biochemistry works well, our brain works well. And so functional medicine, I think, gives us an opportunity to look into, how our nutrition, how our gut health, how our hormone balance, how our exposure to toxins all plays together in this big health picture. And what it does is it allows us an opportunity to not just wait until somebody has a symptom and treat them with a drug, but to say, wait a minute, there are measurable components of your biology that we can see aren't working well. Now let's use nutrients or supplementation or hormones or very rarely medications to help to turn this boat around and get somebody healthy again.
Yeah, it's interesting listening to you, and I'm thinking about how it's completely understandable how so many people, when they face chronic health conditions, are waiting for the magic pill, as we call it, because they've
Hmm.
spent their whole lives seeing their doctor and being shown and told that the answer for whatever they're facing is going to be some kind of medication or maybe
Right.
surgery. So of course, this is what we're waiting for. And I love the term health optimization, I was trying, when I think about all the doctors I've seen in my life, outside of my, functional medicine doctor that I saw years ago, I think not a single person ever asked me about diet, or
Oh,
sleep or
I know.
stress or anything like that. And one of the great opportunities, which is why it's so great we're having this conversation, is that when you go through these chronic conditions, even though they don't feel like opportunities, and I wouldn't wish them on anyone, but it
Right.
is an opportunity for health optimization. And I learned so much about nutrition, so much about my body, and I came out all around a healthier person as a result for having gone
Hmm.
through this. So I love that we're diving into some of these other components, how they are complementary to the nervous system and things like brain retraining, but just all those other pieces. Like we say, there isn't an invisible line and everything down here doesn't matter, but we also
Right.
can't just focus here.
Right.
We need to look at the rest.
And let me take that just a step farther because really health occurs on a continuum.
Mm.
And one of the challenges I see in conventionally trained practices, this allopathic approach, is we've assigned kind of signposts to say that your blood pressure is greater than 140 over 90, you need a antihypertensive drug, or your body mass index is now 35%, you've got massive obesity, we need to treat that. And one of the opportunities, again, looking at opportunities in the darkness that we miss, is the opportunity to say, wow, your blood pressure has been creeping up, your hemoglobin A1C, your insulin resistance is creeping up, your testosterone is creeping down. And one of the things that I think functional medicine allows us to do is to look for some of those nuances in terms of health, and not saying, oh, your total cholesterol is greater than 220, let's put you on a statin drug. So I think that one of the things that people may be challenged with, and maybe this is a good thing to discuss, is how do we best navigate this interface between what we know is going on in our body, questions that are currently unanswered, and a mainstream medical system which is sort of regimented, where it's like your hemoglobin A1C has to be greater than 517. Now you're pre-diabetic and we'll put you on a medication. What about when it was 5.4, converting to
Yeah.
5.5 to
Yeah.
5.6? I mean, maybe these were some
That one
opportunities to
little.
look into,
um,
right, look into some of these things. Like, as you said, diet and nutrition, and these things are so important. So I think it's an ongoing practice. And what's interesting is this, is that people in my audience, people in your audience are so smart. And I was always blown away in my last brick and mortar medical practice when people would come in having done all this research online, literally copying scientific papers that they would bring into my office about their detox pathways or their hormone metabolism or nutrition or anything. And they said, I tried to show this to my doctor and they poo-pooed me. And they told me to go take a walk. They said that there's no science behind that. They said that vitamins are just expensive urine. But yet on the flip side, there are thousands and thousands of scientific studies that are out there that are showing how we can measure and manage and optimize our nutrition, showing how we can measure and manage and optimize our cortisol states. And I think so. One of the challenges is how do people develop this bridging their needs, their understanding of their bodies to a medical community that may not have the wherewithal to either understand it or the breadth of understanding to realize that there are a lot of other factors, whether it's laboratory testing or nutritional interventions or stress reduction techniques that can be put into place to help their patients.
Well, that's one of the great things about our current, state of time. Many downsides to it as well, but in this information age, you might not end up in a doctor's office who is informed on these topics, but it doesn't
Hmm.
mean you can't get this information. So that's
Right.
why I was excited to have you here and deliver you right to people's homes so they can have
All
this
right.
information.
In the privacy of their phones and their computer screens. But Raylan, let
Yeah.
me just say that there's a flip side to that as well, and that is that, as we both know, there's a lot of noise out there in terms
Yeah.
of the steps that we need to take, the interventions, the diet, the supplements, the
Mm.
nutrients. What's the best way to balance or measure your hormones? And I think that similarly can create a lot of anxiety and a lot of stress as people try to find a path to clarify a way to wellness, but yet there's so much conflicting information. There's so much noise.
So let's simplify it then and break it down to some of those core things that really have an impact or can have an impact on the way people feel and on their health. I know
Hmm.
you've mentioned already, cortisol management. So for our audience, let's start with the basics. What is cortisol? We all have a general sense, I think, of it, but really, what is it? Why can if it's a dysregulated cortisol rhythm, why can it be a really critical piece of how you're feeling or what's going on, a part of the puzzle for someone, say, with ME/CFS?
Okay. And you know what I'm going to do is to start this. I'm going to put this question back to you
Mm.
and say, what do
Uh-oh.
you, with all of the people you've spoken to and all of your understanding, what is your simplified understanding of what cortisol's primary job is in our body?
Okay. We don't actually talk about cortisol here a ton. That
Okay.
said, I'll tell you where I come from on this and what I've picked up from the interviews that I do. Cortisol has a bad rap. It needs a new PR agent because we
Right.
generally think of it as all bad. Like, we don't want
Right.
to have any cortisol in our body. It only arrives when things are wrong or when we're very stressed or, we're being attacked by a bear. Then that stress, cortisol gets released into our body. But it's a lot more complicated than that. And it helps to,
Hmm.
actually regulate things in our body and how our body functions. And that many of us, I suspect, from the interviews that I've done, because they live in a high stress, high alert, high threat, fear state for much of their life, that their
Hmm.
cortisol is probably out of
Hmm.
balance as well. So
Right.
that's
And
what I
and
would say.
I didn't mean to put you on the hot seat. And the reason I did that is
Oh, it's
because
fair.
most people rightfully say that cortisol's primary job is our stress hormone.
Yeah.
We think of it as kind of like when you run into a bear or you get into a,
Hmm.
traffic jam or you're late for a meeting or something, that raises cortisol. But if you open a biochemistry book and look to see what cortisol's primary job is in the body, it's to maintain our body's blood sugar. And that is it. That's its first and foremost job in the body. So when I open my
I did
biochemistry
not know
book,
that.
it says cortisol's job is to regulate blood sugar. So clearly this is important because
Yeah.
we have different parts of our body. I mean, our brain's primary food is glucose, and cortisol's job is to find glucose in the body to put it into our bloodstream to keep our brain doing well. Now, don't get me wrong, a brain can run on ketones, which are a different molecule, but our brain's preferred food is glucose. So, cortisol's primary job is to raise our body's blood sugar. And the way that it does this is by breaking down tissues. How many people who are in the ME/CFS community are feeling like they've got aches and pains, like they're losing body mass, they're weak, that it's harder to climb that flight of stairs. What has happened is that for a lot of people that get into this higher cortisol state, cortisol then basically scavenges the resources that we've stored on our body. And this probably goes back to a ancestral time when, we're fortunate in the year 2025 to be able to, run down to the corner store and pick up a loaf of bread, or we can do that 24 hours a day. But the human animal historically on this planet has probably been exposed to lesser exposure and less opportunity to food than a greater
Mm.
opportunity to get food. So my understanding is that we probably went through periods of feast and famine. So, there were some years when our tribe killed a bison, some years when the corn came in, and other years when it didn't. So let's just assume we're in a period where we've not been able to get enough food into our bodies for a long winter ahead. If we're not taking food into our mouths, our body still needs glucose to keep our brain alive. We still need minerals to run our biochemical pathways. We need amino acids to make neurotransmitters and things like this. So what happens is that cortisol breaks down the body. And if I want your listeners to only remember one thing from this talk, it would be is that one, cortisol is the king of hormones. So cortisol basically, its primary job is to keep us alive. And what's interesting about cortisol is it's one of the few hormones that we cannot live without. So if we stop making cortisol in our body, literally things shut down. The human animal cannot survive. So cortisol basically has agency over all these different components of our
Wow.
body. It tells our gut how to work. It tells our thyroid gland how to work. It tells our kidneys how to work. It tells our blood vessels how to work. And importantly, it tells our brain how to work as well. So cortisol is really the king of hormones because at the end of the day, all of the other hormonal systems in our body are going to bow down to cortisol's request, which is say, liberate energy to keep this animal alive. And it does this by breaking down our fats. That cortisol breaks down our muscles into these amino acids that our body uses to make other proteins and things like neurotransmitters. It breaks down our bones to liberate calcium and magnesium and zinc. And it all makes sense because if you're an animal and you know that you're going to go through periods of time when you may not be able to find enough food, it's nice to know that we've got the resources stored in our fat, in our muscles, and in our bones to basically keep us alive until the bunnies and the berries and the bison come back and we can begin to eat again.
Yeah, and I love the how you keep referencing us as animals because clearly we are, but many of us don't think of ourselves that way. And somehow, with our big brains, that we are no longer biological creatures, and none of this stuff applies to us. But it's just good to remember that we have bodies that have evolved. They are there to help us to thrive. And I had no idea that cortisol did so many things. It is so poorly misrepresented in this world. I suspect very few people know that.
Right. And what's interesting is that yeah, it gets kind of a bad rap. And so
Mhm.
I made an assertion earlier that cortisol's job is to raise our body's blood sugar. It's what the biochemistry books say. What's interesting is that cortisol is secreted over the course of the day on what's known as a diurnal pattern. And diurnal basically means that it's something that's secreted by our body that changes. In other words, it's not released. It's just kind of like a steady level at the course of the day. So here's what's interesting is our cortisol spikes between like maybe 3 and 7 o'clock in the morning when we're sleeping.
Mm.
Why is this? It's because if you think of there being a time, well, these days we can sit up in front of our computers until, midnight, 1, 2 in the morning. Again, that's one of those stressors I try to avoid. But when there was a time when we didn't have electric lights, we probably went to sleep in our teepees or our caves when the sun went down. So let's just say that was 6 in the evening. The sun's going to come up at 6 in the morning. Well, what happens is you're sleeping at 6. By the time 2, 3, 4, 5 o'clock in the morning comes around, you've been fasting for this period of time.
Mm.
So our body is built such that we've got this diurnal, we've got this rise of cortisol that occurs in the wee hours of the morning to help to maintain our blood sugar to keep our brain alive. Because if we're sleeping, we can't be eating at the same time. So if there's any, I guess, support of the assertion that I made that cortisol's primary job is to raise our body's blood sugar, all you have to do is look at one of these cortisol curves. 365 days a year, every day of your life, cortisol should be rising up in the early morning hours. Now, the operative word there is should. And the important thing to recognize is this, and this is going to be so valuable for your listeners, and that is that cortisol, like I said, if you looked at it at a curve, it's released really slowly, progressively over maybe a 3 to 4 hour time frame at night. Even if a bear jumps out at you in the woods, it still takes a couple, 3 minutes for our adrenal glands to get cortisol mobilized and into our bloodstream. But cortisol has a co-conspirator, and that is adrenaline. So when that book falls off of the shelf and it makes that loud noise that causes you to start, like so many people have experienced, when you do really encounter a bear in the woods, the first thing that hits your bloodstream is adrenaline. Now, adrenaline's job is to get us away from the threat, but its job is also to raise our body's blood sugar. So what happens is, and this is interesting, and I'm sure that there are going to be listeners who can relate to this, is if we're not able to raise our cortisol in the middle of the night or in the normal fashion because our cortisol is not working well, we have a backup plan, and that is to use adrenaline. And I can tell you that in measuring so many cortisol curves in thousands of patients over my career, I can tell you that as people's cortisol becomes less functional and as our brain starts to bring down that cortisol response, again, through the amygdala and the hippocampus and the hypothalamus, what happens is our body uses adrenaline as a backup generator. So have you heard from people who wake up at like 2, 3, 4 o'clock in the morning and they're
Mhm.
just wide awake? I mean, it's like snap, they're awake in attention. They're ready to start vacuuming their house or writing a book or something. They can't go back to sleep.
Um,
And I have found that when people get into significant cortisol dysfunction, that one of the reasons that our adrenaline spikes like that, or during the day for that matter, is because we're needing to raise our blood sugar. Our cortisol is not working well, and our body goes to the more wild, less predictable, but very effective backup plan of having adrenaline to raise our blood sugar. And this might apply to people who are even finding those spikes of anxiety through the course of the day. And having spoken with hundreds, if not thousands, of patients who are struggling with fatigue, there's sort of a phenotype, which is kind of like the tired and wired. Have you
Yeah,
heard that?
definitely.
And so I think that what happens is if we're not managing our body's blood sugar appropriately through diet and through appropriate, correct cortisol release, we've got our backup generator in place. And that is adrenaline. So that's the person who all of a sudden is, frantically screaming at the kid who spilled a glass of milk, or jumping up from the desk and running to the break room, just thinking there's a box of cookies somewhere. What we're trying to do is we're trying to regulate our body's blood sugar through adrenaline. And I think that's one of the problems. So, cortisol is such an important player. Like I said, it breaks down our body to liberate all these nutrients to keep us alive. It typically has this diurnal pattern where it rises up in the middle of the night and comes down over the course of the day. We don't need a lot of cortisol in our bloodstream during the day because, in a best case scenario, we are able to eat food. But when we're not getting in those calories that we need, when our cortisol is dysfunctional, it resorts to adrenaline. And adrenaline is that shot out of a cannon, anxious, sweating, nervous. You're saying, behaving, doing things that you look back later in the day and you're like, why did I do that? But I think it all comes back to this cortisol picture.
So, what does that mean for the average person or the person watching this video right now, listening to this? How do you know what's happening with your cortisol? And then how do you address it?
So let me take a step back. What typically happens, and this goes back to studies that were actually done like in the 1920s, 1930s, by a Hungarian doctor by the name of Hans Selye. It's Hansselye. Really interesting doctor. And basically, what he discovered is that there's sort of like different patterns of cortisol response. So what we have is we typically have like an alert state, and that's a normal cortisol response. I mean, a bear jumps out of the woods, we have a period of time when we're not able to find food. It's normal that our cortisol goes up. But what happens is so often in modern life, we maintain our cortisol in sort of like a high cortisol state for a period of time. And that's all generated by either our body's physical and metabolic needs, like not having the blood sugar in your
Mhm.
bloodstream, or as you know, so much of cortisol is driven by our minds. And we are really unique animals in the fact that we are able to generate a high cortisol, high adrenaline state through nothing more than our thoughts. But then what Dr. Selye showed is that after we maintain this kind of adaptive state of high cortisol for a period of time, like the song says, what goes up must come down. And we get into sort of like a low cortisol state. And the reason I spent some time to go over that is that it's really hard to know just from symptoms. If you're in a high cortisol state, you're still in that excitatory, adaptive kind of maintenance state of high cortisol, or if somebody has kind of gone over the falls. And I think that when somebody does kind of go over the falls. In other words, when they do get into a low cortisol state, that's what some doctors refer to as a stage 3 adrenal fatigue. And these are typical, a lot of the symptoms associated with this are just really significant fatigue. Some of the anxious symptoms that I described earlier in our talk, a lot of people who are in a low cortisol state are finding a need to take a nap in the mid afternoon. So these are some of the symptoms that we can see with a low cortisol state. But conversely, a high cortisol state has a number of symptoms as well. Because what happens is when our cortisol is high, our body's normal physiology has a significant number of effects on other components of the way that we work. So we know that high cortisol states affect our thinking and our cognition. We know that high cortisol states divert blood away from our gut. How often do you find that people who are struggling with ME/CFS are having gut issues or constipation or not feeling good? High
Yeah.
cortisol states sends us into a relative state of hypothyroidism. And this is really cool because remember, if our cortisol is high, remember, if we don't eat, cortisol goes up. If we're starving, we're in a high cortisol state because it's breaking down our fat and muscle and bone reserves to keep our body alive. If you were God or nature, would you want that animal to be in a high thyroid state with a high metabolism or a low thyroid state with a low
Yeah.
metabolism? And of course, the answer is a low metabolism. I mean, if you've been able to pack on a finite number of calories onto your bones and you're going hungry, you don't want to go full tilt. Same way, if you're running out of gas in your car, you don't sit at the stoplights and rev your engine. So the human body is the same way. So the high cortisol state can affect our thinking, can affect our thyroid function, can affect our skin and hair. It can affect the way that our gut works. And not surprisingly, it affects our hormonal levels as well. Going back to, being God or nature, or I actually think, humans were created by kind of a combination of the two. Um, if you're, say, a woman and you're in your cave and you're starving, is that a time to have a nice ovulatory uh, cycle and to get
Yeah.
pregnant? No, nature is really smart. It knows that that's a time to dial back our metabolism, to change our menstrual
Mhm.
functioning, to lower our testosterone levels. I mean, if you're starving in a cave and you're hypothyroid and not feeling good, that's not a time for a roll in the hay, right? So you can
Mhm.
see how as we get into greater states of cortisol dysfunction, there are any number of different body systems that begin to get affected by it. And the beauty of cortisol is that we can control it through our minds. So all of this stuff circles back to what you teach on your channel is the power of brain retraining, of finding places of safety, really assessing what is a true threat and what is a perceived threat. And as we are able to get greater control of that component of our physiology, our cortisol works better, our gut works better, our brain works better, our reproductive process works better. Everything falls into place.
This is fascinating. This makes so much sense and helps me understand things, the bigger picture of what's going on in these situations so much better. I'm surprised I'm not hearing more people talking about cortisol and its connection to the nervous system, to our threat assessment systems. So, what is the best approach to normalizing the levels of this? Is it going through through your thoughts, through your brain? Is it going through
Mhm.
some sort of, physical interventions? Or maybe I'm getting ahead of another step that we need to cover
No, no,
first.
no.
I'm just
That's
wondering
this,
where.
this. This is a great question because, as I mentioned, there are two things that raise our body's cortisol. One of the is this normal cycling, this normal patterning that's kind of hardwired into the way our body works. The same way that, women are supposed to have an ovulatory cycle every 28 days or so, like monthly periods. We've got other systems in our body that follow a certain patterned response, and cortisol does that. But the interesting thing about cortisol, Raelan, is the fact that we have the capacity to modulate our cortisol release through nothing more than our thoughts. There was a great book that was written by a Stanford doctor whose name is Robert Saplonsky. And the title of the book is Why Zebras Don't Get Ulcers. And the reason that zebras don't get ulcers is that when they're running from a tiger, that's all they're thinking about. They're running from a tiger.
Mhm.
Their cortisol is high, their adrenaline is high, their heart rate's high, their blood pressure's up. But when they're sitting and grazing, they're not grazing and thinking to themselves, okay, the next time a tiger chases me, I'm going to run real hard towards the edge of the cliff and then I'm going to stop and the tiger's going to go over the cliff. But wait, if the tiger doesn't stop,
Yeah,
then I'm going to be really close to the tiger. Then, okay, wait a minute, but I'm going to have to graze with one eye.
yeah,
They don't do that. The thing is that we as
yeah.
humans maintain the ability to, from our limbic system is where it all starts. And, it then instructs our hippocampus, which then instructs our hypothalamus. And the hypothalamus is kind of like the relay system. It's the switchboard for the way that our body is expected to respond. So then the hypothalamus basically gives its message to the pituitary gland. And the pituitary is what sends out signals to say, ovulate, or make thyroid hormone, or make growth hormone, build muscles. What's cool is that we have the ability to modulate our cortisol response through nothing more than our thinking. And what's so cool is that everything that you teach on your channel is all directed towards helping to modulate that cortisol response. In other words, maintain those threats for when a bear really jumps out of the forest at you, right? Maintain your stress for when you really haven't eaten for 2 days. What
Mhm.
happens is when we are able to help to calm that stress response, really everything else in our body, all of our pains, all of our aches, all of our bloating, all of our everything begins to follow suit. And this is kind of like a nice place to kind of tie everything back to where we started this discussion, because I told you that for me, having had several brushes with different components of sort of a chronic fatigue picture, for me, my single most important thing that I attend to on a daily basis is my cortisol response. And I do it through my thinking. I do it through the way that I eat. I do it through the way that I exercise. I do it into the evening in the way that I engage with books or electronics or what have you. So I can say that for my success in being a really healthy, active person, it comes down primarily to ensuring that my cortisol stays in balance. And I've actually measured my cortisol on several times in the past. And there was a time a year and a half ago, I was launching a course that I've been working on for years, and there were all these moving parts. My cortisol was out the roof to the point that the lab that did the cortisol testing had to redraw their normal levels to be able to account for the changes that my results demonstrated. Well, guess what? I wasn't sleeping. I wasn't thinking clearly.
Mhm.
My gut was a mess. My libido was non-existent. I mean, all these things followed suit. So I went through, I worked on all the things that I mentioned before. I worked on my diet. I worked on putting myself into places that I know allow my nervous system to decompress. And for me, that's outdoors. That to me is one of the most important things is even just getting outside. So personally, I find that I'm addressing my nervous system continually, primarily my cortisol response. I mean, there's some adaptogenic herbs and supplements that I use as well. I don't want to kind of get into those right now. Maybe we could save that for another talk. But um, that's I think one of the most important things is to recognize that cortisol is the master planner for the body. Cortisol is king. And when we go through the behaviors and the modifications and the EMDRs and all the things that we know about to help to bring down that cortisol response, that's the crux, I think, of aligning the cognitive changes that are associated with chronic fatigue and ME and assimilating how that also works with the way that our biology works and our physiology as an animal on this planet.
This is really helpful to see the big picture of things because I know lately we divided in when we look at what's causing chronic symptoms. And a lot of what we talk about, and I'm guilty of this, is it coming from structural issues in the body or is it coming from your brain and your nervous system? And people are saying, well, I think it's coming from my brain and nervous system, but I see structural issues in my body, like
Mhm.
observable,
Right.
measurable, physical things are happening, which is very
Yep.
confusing. And
Yeah.
this, and it's like we've oversimplified it a bit, saying it's one or the other. The root cause may be one thing, but it's also impacting and changing things in your body. And that's why you're seeing these changes in your body with your digestion, with your hormones, your menstrual cycle, your
Mhm.
metabolism, and a zillion other things. That yes, physical changes, physical things, observable things are happening in your body, and it's all connected.
So I said earlier on that if there was one take-home point that I wanted people to remember, which is that cortisol is the king of hormones, and I'd say I'd add another point in on the coattails of what you just said, which is I like to see as the body working is kind of like a yin yang. And half of the yin
Mm.
yang is the mind, and half of the yin yang is the physiology. So, as we just discussed, talking about cortisol, we can drive components of our physiology, whether it's blood flow to our skin or blood flow to our gut, or the way our reproductive cycling works through our thoughts. But on the flip side, the way that our physiology works also contributes to the way that our brain works. And we know that
Mm.
as people get significant deficiencies in different vitamins or minerals. We know that as we get more inflamed from either a chronic infection or a common cause is fat accumulation, that those inflammatory patterns also influence how it is that our brain works. So it's important to remember that this is a yin yang, and the brain influences the body, as evidenced by what we talked about with cortisol. But yet, the
Mhm.
body and our nutritional status, if nothing more than the calories that we maintain in our bloodstream, again, heralding back to the discussion we had on cortisol, that influences the way that our brain works as well. And so I think it's impossible to tease these things out.
Yeah.
And sadly, I think that's one of the problems. We talked earlier about what are the shortcomings of modern medicine is they lose the ability to create sort of an amalgamated look at these components of what our body requires to work well. We need our brain to work well. We need our physiology to work well. And these continually influence one another.
So I know you and I talked about before we started recording. One of our goals with this was to make sure that we weren't making people feel more overwhelmed or more fearful about what's happening in their body. And it's very easy with all these moving parts. Even just looking at your case with the hormones,
Hmm.
infections,
Right.
brain injury, stress. Like, how do you not get overwhelmed? So, how do people navigate healing with all of these different components without becoming this
Yeah.
stressful, full-time job.
Boy, that's spot on, and I have to say that in some ways that's kind of the $64,000 question because it's hard to know where to start. And so let's
Yeah.
really make this granular. Let's start at the very core of all this stuff. And the core of all this stuff is that what you are feeling exists. It's real. And that's just the most important thing is that don't let someone say that you shouldn't be so tired or you shouldn't feel this way or you did something this last weekend. Why can't you do it this weekend? So the important thing to recognize is if you're feeling something, that is your reality. I mean, it's almost like we all have on our own virtual reality headsets. The way that we perceive the world, the way that we perceive, what's beneficial, what's helpful, what's a threat. It's all unique to each one of us. And I just want to, basically validate that if you're not feeling well, you're not feeling well. I mean, it's really happening. If you're feeling pain or fatigue or low energy, those things really exist. So the steps to take to be able to turn this around, I think are first the things that you teach is to work on working to identify what's a real threat and what's not a real threat, and then naming things, learning how to breathe, being how to be in the moment, because it's so easy. And I'm the worst example of this, of getting in my head and fretting about what's going to happen 2 weeks from now when what I really should be doing is just appreciating the sound of the birds outside my house. In terms of approaching things from a medical standpoint and keeping things simple, I think one of the most important things that people can do is really focus on some of these brain retraining practices because I've gotten the point apart across here that cortisol is king. Cortisol affects every other component of our physiology. So if you want to do one thing that's going to help to make your gut, your brain, your reproductive organs, your skin, all this stuff work better, it's get your cortisol into control. And then probably the next most important thing, which again should be no surprise after this discussion that we've had, is maintaining the right amount of calories in your bloodstream. And I know this sounds so simple, but it's easy for people, particularly if they're really struggling with chronic fatigue and having a hard time getting off the couch or preparing meals or things like that, is remember that your body requires a pretty steady state of glucose in your bloodstream to be able to stay well. And for the people who are waking up in the middle of the night, bolting out of bed at 3 o'clock in the morning, I recommend that before they go to sleep at night, maybe they have a high fat or high protein snack, a bowl of yogurt, some beef jerky, some nuts. This is going to help to maintain your blood sugar while you sleep. For people who are really struggling with those shot out of a cannon bursts of anxiety that seem to come out of nowhere over the course of the day, maybe you need to be taking a few more carbohydrates into your diet just to maintain those sugars in your bloodstream. And I'm not saying go eat a whole, Albertson's birthday cake. I'm saying use some of these carbohydrates to help to maintain these important components of your physiology. Because if you can do that through your diet, then your hypothalamus and your pituitary gland don't need to do it through the release of cortisol. And I think that's probably where I'd start. I think maybe in subsequent talks, we could get into some of the different sort of substrata of the things that we can do to really ensure that our health is good, because I agree that it's overwhelming. The most important thing is recognize that if you're having symptoms, those exist. Don't let anyone tell you that they don't exist. Even though your labs look normal, your testing looks normal, your blood count looks normal, if you're feeling symptoms, these exist. And I believe that individuals can be guided through an understanding of their physiology in a way that's not complex and it's not overwhelming, but it does take a little bit of time. And as I said, maybe you and I could explore some of those paths, at a later date. And most importantly, you have agency in your health. In other words, if you feel like your doctor is a jerk and gaslighting you and neglecting your concerns, try to find another doctor. There's somebody out there who's really going to listen to you and to care. And if you are coming to your doctor and saying, what about optimizing my thyroid? Or what about measuring my cortisol? And they're like, there's no reason for that. Know that there are more and more providers out there who recognize the value of obtaining more comprehensive laboratory testing to get a really good idea of what's going on in your body.
Well, there's so much to cover. And Dr. Resnick, it would be wonderful to have you back. And people watching, it would be great if you could share in the comments, what do you want to know about? What questions do you
That's
have?
right.
What's still confusing for you? And we will read those and we will make sure that we address those things as best as we can. Only so much we can cover in each video.
That's
But
right.
definitely what do people want to know? It would be wonderful to have you back. This has been incredible. So much insight. I've learned so much just from this one conversation. I can only imagine all the other wisdom that you have and insight about optimizing your health. For our
Mhm.
audience members who would like to, between now and this next video, when we have you back, they'd like to learn more about what you do. What's the best place for them to find you?
Well, like you, I have a YouTube channel, and really the premise of that channel is to take complex medical subjects and to simplify them so that people have an understanding of the way that they can utilize that component of their biology or their physiology or their biochemistry to turn around their health. So it's all based in simplification and clarification and fundamentally within a functional approach. Again, we're not just talking about medications you can use to help your depression or your weight gain or what have you. It's more about ways that we can guide the way that our physiology works so that our brain works well, or ways that we can guide the way our brain works
Mhm.
or our physiology works well. So that's probably a good way to learn about some more thinking. It's like as you mentioned, there are so many different components of that we could discuss. I mean, the way that the gut and the microbiome is making our neurotransmitters, the importance of inflammation. I alluded to that earlier in our talk. I mean, if I could, as a medical doctor, if God commanded me and said, Scott, you can only measure one laboratory test on your fatigue patients, I'd look at a marker of inflammation because there's so much information out there that shows that when we're in an inflamed state, we've got those myalgias. We have that foggy thinking. We have, we're feeling fatigued and slowed down and sluggish. So we could talk about all those things in another talk if you like.
Yeah, and that's great. It's on your YouTube channel. People can start checking it out in between and all of this free information. And of course, this will all be linked in the video description so
Great.
people definitely check it out. And for those of you watching that are having a challenging time finding a doctor that is in the know about treating chronic conditions, the great thing is we can bring this to you. So I'm going to link a playlist here, and it's all medical doctors that I've interviewed talking about different aspects of optimal health and recovery from chronic conditions. So much free and amazing information out there. Dr. Resnick, this was wonderful. Can't wait to have you back.
Oh my gosh.
Thank you so much for being here.
As always, it's so nice to meet with you, and I like to think that if we just helped one person from this talk today, that this was beneficial. And
Yeah.
I'd love to join you again. And I just want to encourage people to, have faith, and you're going to get better. Take the baby steps, pay attention to things, and keep on tuning in with Raelan so you can get all these good points.
And Dr. Resnick. I love it. Thank you. Thank you so much to everyone who's watching. Thank you again, Dr. Resnick. And I hope to see you in one of these next interviews.
Alrighty,
Bye,
take
everyone.
care.